Welcome, and thank you for tuning in to A Sound Constitution on CHLY 101.7 FM from Nanaimo with your hosts Max, Kelly, Carla, Harris, Cassandra, and Samantha. We are third-year Bachelor of Science in Nursing students at Vancouver Island University. We are working to demystify health issues affecting our community by bringing you evidence-based information about healthcare. This information is for educational purposes only and does not replace the advice of your primary healthcare provider. We would like to start our show by acknowledging that we are on the unceded territory of the Nanaimo people with a broadcasting range that overlaps the Coatson and Sliammon territories. This acknowledgement is done with gratitude to the Nanaimo people and with the intention to increase awareness about truth and reconciliation processes and efforts on Vancouver Island.
Hi, welcome to A Sound Constitution. Today's topic is health literacy. My name is Harris, and my co-host joining me is Kelly. Before we get into it, though, let's introduce you to our 2021 hosts for this season.
Hello, everyone. My name is Kelly, a third-year nursing student at Vancouver Island University. I've lived in Nanaimo for about 5 years, and before that, I was in Abbotsford, and even before that, I was in Edmonton. I have an interest in women's sexual health, geriatrics, and cardiovascular health. In my spare time, I enjoy reading and music. One of my favorite books is Stoner by John Williams.
Hello, everyone. I am so excited to be here with all of you as one of your radio hosts at 101.7 CHLY FM. My name is Samantha, and I am a third-year BSN student at Vancouver Island University. I was born and raised here in Nanaimo, and I'm so thankful to live on this beautiful island. I have a passion for learning, whether that's in class or within our community. I believe no one is too old or too smart to grow and learn from one another. I have been told I am much like the character Ross from the show Friends, a little awkward and very into science, which I think I'll take as a compliment.
Hello, my name is Carla Caratu. I am a third-year nursing student at Vancouver Island University in Nanaimo, British Columbia, Canada. I look forward to helping people find answers to important health questions, empower them to make changes, and build resources in our community so that we can really thrive and stay connected during this pandemic.
Hi, my name is Harris. I'm a third-year nursing student at Vancouver Island University. My goal is to finish and get my specialization in emergency nursing. I've only lived on the island for about 3 years now, and it's been great. I originally come from the land of ice and snow, known as Saskatchewan. My hobbies include hiking, spending time with my cat, and putting my girlfriend in dangerous situations when I drag her along on adventures. I like music, science, and all things related to health.
Hello, CHLY listeners. My name is Max, and I too am a third-year Bachelor of Science in Nursing student at VIU. I'm aiming to work in perioperative or post-surgical nursing, and when I'm not buried underneath a giant mountain of homework, I like to get out hiking and exploring Vancouver Island.
Hello, all. My name's Cassandra, and I'm going to be one of your myth-busting, health-talking radio show hosts. I'm a third-year nursing student at Vancouver Island University, born and raised in Nanaimo, and a bit of an adrenaline-seeking, adventure-loving kind of character. My passion for life has always been to help make a difference in any individual's life, and to leave nothing but a positive, everlasting impact on the world surrounding me. I am honored to have the opportunity to learn and grow with this community and the individuals in it. It's going to be a fun-filled season with a sound constitution, so be sure to tune in every Thursday afternoon at 2 p.m. on CHLY 101.7 FM radio.
Today's topic is about health literacy. In order to kind of get a little bit of familiarity with the topic, let's kind of talk a little bit about our personal experiences with health literacy. Kelly, can you tell me about kind of your experiences growing up, your understanding of what health literacy is, as well as kind of your overall journey of understanding what is involved when it comes to being health literate?
Well, when I was little, I never heard of the term health literacy, but when I was 14, my grandfather had lung cancer, which, when you're little and you hear cancer, it's pretty much a death sentence. You know, the big C, it's scary. So what I did was that I went to the local library and to look for medical books so I can actually understand what the doctors are saying, and also to help my family as well, because everyone was just traumatized by that diagnosis. And then once I actually knew what the terms like benign and metastasis, and then what a chemotherapy actually is, it actually became less scary. So then he went under surgery, and then everything turned out fine. He's doing well now. So I think with health literacy is that in the medical field, everything seems so, mysterious and difficult to understand. But once we actually do the education, we feel like we're more in control. And it's that control that gives us a safety net, sort of in that sense. And that's why that was sort of my first experience was health literacy. And then before that, I was never really interested in taking care of myself. I was little, I had my parents, they did everything for me. But then it was after that I realized how important having an education around your own health is. So that's actually one of the reasons that motivated me to go into, the medical field. But yeah, so then I began reading more. I talked to my healthcare professionals, my family doctors, the specialists a lot more. And then I also have asthma, so then I had a better understanding of what that was like, what medications I needed to be take, what the triggers are. So like for me, I was very responsive to cold air and dust, so that triggers my asthma. And then just overall, it's sort of a growing process. Once you build up on the different medical terms that you understand, you become more health literate, you feel like you're more in control of your life and you can better advocate for your health. So that was sort of my experience with health literacy. What about yours?
Yeah, I guess for myself, it was kind of similar in the sense where you had an ill family member. With like ill family members, you tend to have always like the big question of why. For myself, also, it came from a place of curiosity with science. I was from a small age wanted to know why. That was kind of the big question that we all have, right? We want to understand things around us, why things happen. And so when we're faced with people in health crises, you want to get to know it better, right? Like you growing up, I had asthma as well. And so for me, it was constantly just evolving that point of view, like looking into it, asking questions, being curious. There was times where obviously I felt insecure about my knowledge of health. I think that's common with most people where, especially when you look at the science involved with it, you can feel very overwhelmed. And I think that's obviously a barrier that some people struggle with. But I think for myself, it was always kind of answering that overall question of why, and then, adding on top of it, how, and then creating that understanding and realizing that health literacy is ongoing, right? We're constantly learning, we're constantly researching, we're constantly advancing. And so my experience is kind of knowing that health literacy is a lifetime goal. And as such, we need to kind of pursue that. So yeah, I think that's my personal experience with it.
Health literacy is something that's, a lifelong process and it's constantly evolving. And I guess in your case, it's the why and the how that sort of got you interested. So I guess you could say that curiosity doesn't kill the cat.
No, not at all. I think if anything, it makes the cat healthier, so to speak. But yeah, I guess, what do you think, like taking that journey one step further? Like how has your view of health literacy changed since you've joined nursing school? We're in our third year now. So what do you feel has changed?
For me, I think I have a better understanding of what it actually is. So before I got into nursing, health literacy to me, it was more like, I'm looking at a scientific paper or I'm listening to what my doctors are saying and I'm able to understand it. But then after being in nursing school, I guess my view sort of shifted in that I think there's different levels to health literacy. So I guess you could start with, basic knowledge of reading and writing. So like what I was saying was reading a scientific article. And then if you go a level above that, it's being able to communicate it. So being able to speak the language, it's like kind of like learning a new language, I guess. And then apply that information to different circumstances. And then if you're to go like a ladder higher up, you can talk about how sort of you're able to critically use that health information given to you and use it to exert control over your own life in different situations. So that's what I was thinking. So health literacy is not just one term where it's like being able to understand medical terminology. No, I think it has different layers and levels, and it's something that we as a society need to collaboratively learn together, especially during the time of COVID-19, where, it's a new virus, everybody is learning.
That's exactly it, is like understanding the complexity of what entails health literacy. I think for myself, something that came out of it was getting comfortable with your own health literacy, but then finding ways to communicate with other people, especially like as nurses, well, future nurses, I guess. We're responsible for communicating with the general public, right? And making people feel comfortable with whether it's the medication they're taking, the health crisis that they're in, as well as being comfortable with their current health. And I think it's kind of like Neil deGrasse Tyson said, where a true sign of understanding is taking a complex idea and being able to explain it to a 6-year-old child. And I think that goes to show, especially with health literacy, where rather than getting caught up in the medical jargon or getting caught in the complexities of the science itself, finding that bridge and finding that kind of way to kind of get through to people and understand their health, be an advocate, if anything.
And in nursing, we talk a lot about client empowerment as well. So I guess in that sense, it's at that critical level where clients are able to take that information we're telling them and then apply it into their own lives and have that control. So that's the sense of empowerment.
Exactly. So kind of bridging from that, we've talked a little bit about our personal experience. As we've learned throughout our schooling, there's different groups that we can kind of talk about how it might impact them, whether it's new Canadians or immigrants that have come to Canada, Indigenous people or rural communities and larger cities. Let's start with talking a little bit about like immigrants and new Canadians. Like, what do you think you could tell me about health literacy and how it affects them?
Well, with immigrants, I think the biggest problem is language barrier, right? Learning English as a second language. I think one, it's challenging to, sort of having to adapt in an English speaking environment. And then two, you also have to be able to use the language to advocate for your own health. So I think it's very difficult in that sense. That's why a lot of immigrants suffer from depression and anxiety, because they feel like that control, which they might have had previously in their former countries, being pulled away from them. And then that's why I think, especially in bigger cities, they're doing a lot better because they're able to have that resource to have translator to help them understand what the medical jargons are once they're hospitalized. And I just want to put a plug here. I've worked with one of the professors at VIU. We looked at how specifically Chinese older adults and their experience with healthcare, and a lot of them have mentioned that language barrier is definitely a challenge. They have to rely on either their kids or their spouse or grandkids to help them translate that language once they're hospitalized. And I guess once people get older, they feel a lot more vulnerable, and it becomes very scary to go to the hospital. And then as a result, what happens is that they have this fear of going to see the doctor once they feel ill, and then they drag on through that process, and then it takes a toll on the healthcare system once they become critically ill and then having to be hospitalized for a longer period of time, which then again further adds on to the stress. So it's like a cycle. I guess the way to break that chain is, having different healthcare resources that they can access that can make them feel safer and secure to go see the doctor, whether it's in person or online. We can help them bridge through the process of understanding what the doctor is saying, or even just helping them with, or even just like emotional support, right? Being in the hospital can be daunting, especially if their kids are working. Overall, as an immigrant who came to Canada when she was little, I think it's just a very challenging thing to go through.
It'd be a lot to process. And like you said, like the barriers that have to be overcome and like the accommodations that we as a society have to step up and fulfill definitely can make or break the health literacy that new Canadian may understand, right? As well as the care that they receive. especially kind of translating, from New Canadians to Canada's First Peoples. Indigenous people, especially right now in the pandemic, are facing a lot of challenges with COVID-19 on reserves with having large outbreaks. We could talk a little bit about the health literacy and how it affects these communities. For myself, having done some research on previous projects about the relationship Indigenous people have with healthcare, has really opened my eyes to a lot of the challenges that they face, where the incorporation of their medicine with our medicine is being more widely used, looking at cultural considerations, but also at the same time is finding ways to connect with these communities and in a way that benefits them more than what previously was offered. What would you like to say about your understanding of Indigenous peoples with health literacy?
With Indigenous people, I guess, again, one of the biggest thing that we can think of is empowerment, right? Especially for those living on the reserves being, sort of a bit remotely isolated and giving them the needed healthcare. And then again, sort of bridging their own understanding of what medicine is with like sort of the Western idea of what medicine is definitely, it can be very difficult in that sense.
To a certain extent, like contrasting between rural and Indigenous peoples, having access to a primary healthcare provider can be a huge issue, especially when you don't have a consistency of being given care by, that physician or nurse from weeks prior, just because they rotate through medical staff. Having a lack of access to, health researchers, librarians, stuff that can provide information to teachers or people that are in positions of that community, these are huge kind of barriers where in some cases in the past, this wasn't previously being met. And I think especially when you kind of look at where we're looking at improving care, especially once again, going back to Indigenous people, it's having that infrastructure in place, having that ability to have those resources so that teachers and people of that community can teach the children as well as the adults and having that information on hand. And I think that makes a world of difference. And so once again, that's kind of huge thing that needs to be focused on, I think, from my understanding.
Yeah, I do agree. Education is definitely like the bulk part. It carries on the weight in terms of health literacy.
Yeah. Kind of contrasting for like the final point, I guess, of talking about different communities, metropolitan areas is something that we often overlook. We tend to assume that they have a large amount of resources when in reality, the access to information and healthcare providers is drastically lessened because of how many people versus GPs, like with the ratio that exists. And so some people, especially in cities, I know that's a growing problem in Nanaimo, don't have primary care provider. They have to kind of rely on walk-ins and often are reluctant, especially in this age as coronavirus continues on. What would you have to say are certain things that you've seen for metropolitan communities?
Well, I've always sort of been like this small town girl, so it's really hard for me to sort of relate to metropolitan on like a life experience level. But I guess what I can imagine is, like you said, was the overwhelming amount of people. Like imagine living in New York versus Nanaimo, and then not being able to schedule for a primary healthcare provider. That can definitely be daunting and scary. But then again, if we look on the plus side, they do have more access to local libraries and obviously bigger university, I would imagine. And I just want to add on to that, primary healthcare sort of encompasses a lot of public healthcare. So with local nurses, local community workers advocating for that health and providing education. I think in that sense, metropolitan area does a lot better than rural areas just because they have that resource and the amount of staff to do that job.
Yeah, and especially with the studies I've looked at with metropolitan areas, it's not necessarily the access to healthcare among like the city as a whole. It's more so in certain areas. Like if you look at like the socioeconomic status of poor communities, where you look at certain suburbs or areas where there's a high poverty rate, the taxation and where money goes, they sometimes are incredibly underserviced. So you kind of end up in like the same kind of class system conundrum that rural or indigenous communities face, where it's because of the disparities that they already face, by being underfunded and underserved, that poor communities in metropolitan areas really suffer because, they might not have a public library in like a poor neighborhood of a large city, right? And so these are kind of the things that I've seen where it affects health literacy, where the schools are underfunded, they have less access to health resources, which greatly overall affects the health literacy of the community itself, right? Because once again, relating to the principled action, it's education is huge. And it can definitely make or break a community with how health crises impact them based off of their health literacy. I guess that leads me to my next question. How do we improve health literacy? What do you think personally from what you've learned might be a good option to kind of combat decreased understanding of health in their community?
I feel like you and I can agree, and I'm pretty sure everyone tuning in can agree as well, that education is the big factor here. Mm-hmm. Like we've mentioned before, local libraries, university libraries, even going to your GP and asking questions definitely can help you gain a better understanding of what medical terms are and what they actually mean to your lives. And in terms of improving, government funding definitely plays a huge role as well. Like we talked about with metropolitan versus rural. A lot of times metropolitan, because they have more people, they get more exposure. As a result, there's more funding, there's more resources for them to allocate around, whereas rural areas are often ignored. So I guess that's the downside of living in a small town.
Yeah, like in a study that when I was doing some research, something that came up, there was 3 identified actions to kind of improve health literacy in the community. One, obviously, going back to kind of what we talked about regarding new immigrants, indigenous peoples, and even rural communities, was government action. How much money is the government shelling out for some sort of initiatives that they have in place to serve these communities? The other thing that they were looking at was organizational practitioner action. So it's who's available as a resource in that community. Do we have nurses? Do we have physicians? Do we have health organizations that are able to provide resources for these underserved communities or people for that matter? And then the last one, obviously, is partnership. And that's looking at, once again, like a grassroots kind of organization where it may not be directly government organized, but it's groups that have collaboratively worked with communities to develop better health resources for them. And so this has really helped some communities with what they've seen in some studies. And yeah, it's made a world of difference. And as you can see, with schools having nurses that are within the community, just even having access to a community resource can make a huge difference. Those are some things that at least I found in a Canadian study related to that. So speaking of ways that we can understand health literacy, like we can talk about how we find information. And you had a really interesting discussion with Jean Blackburn about that.
I did.
Yeah. So I think what we're going to do is we'll transition to that clip and we can learn about health literacy.
Hello and welcome to the Truth and Myths part of our show, where we look at some common assumptions in the society and explain them in detail. If you're interested in finding out where we got our resources from, please check out our Facebook page at A Sound Constitution on CHLY 101.7 FM. True or false? Eating foods such as spinach, oysters, and crab can positively impact an individual's mood. I'll give everyone tuning in 5 seconds to think about that statement. This is true. A recent study conducted by the University of Queensland in Australia found that foods containing nutrients such as folic acid, omega-3, and zinc can help to elevate an individual's mood and act as a natural antidepressant. Definitely helpful when you're feeling blue. True or false? Drinking energy drinks is the best way to stay energized. I'll give everyone tuning in 5 seconds to think about that statement. This is actually false. The best way to stay energized is to have a well-balanced diet, exercise regularly, stay hydrated, and get enough sleep. Energy drinks usually contain a lot of sugar, up to about 14 teaspoons in one drink, which can increase the risk of obesity and diabetes. As well, a lot of energy drinks contain caffeine, which in high quantities can cause side effects such as an elevated heart rate and difficulty sleeping. True or false? Laughing 100 times a day is equal to 10 times of exercise on a rowing machine or 15 minutes on a stationary bike. I'll give everyone tuning in 5 seconds to think about that statement. Interestingly enough, this is true. A science-based website called How It Works speaks to researchers identifying that in fact, laughing 100 times a day is equal to 15 minutes on a stationary bike or 10 minutes on a rowing machine. So for those of you who are looking to start an exercise regimen, let's add laughing to the schedule. Hello everyone, and thank you for joining us at CHLY 101.7 FM. I'm Kelly, and I'm with Jean Blackburn from Vancouver Island University. To start, I just want to say thank you, Jean, for joining us on Zoom today and willing to share your thoughts on health literacy. So, Jean, can you tell us a little bit about yourself and your role at VIU?
Sure. I've been at VIU since 1998, so it's been quite a while now. I love working with students in all of our health programs and in other programs at VIU. I also coordinate the library's print and digital collections management and work with library systems as well as being the liaison librarian to health programs.
Wow, that's 1998. That's actually right around the time I was born. That's been a while.
I've seen a lot of changes at VIU and in the library world, that's for sure.
Yeah, definitely. Change is a big topic nowadays. Thank you for your self-introduction, Jean. So let's dive into today's topic, which is health literacy. This is a very important topic, especially nowadays with COVID-19. So Jean, why do you think health literacy is important?
Sure. Well, I mean, it's no surprise. I think health literacy is important. I'm going to be an advocate for health literacy because I'm a health sciences librarian, among other things. I think even deeper than that, though, on a personal level, I think access to quality health information is one of the most powerful life tools at our disposal. And I find it very rewarding that my work contributes to this. In recent years, I've experienced that power in a very personal way as well, not just professional. My dad was sick with terminal cancer, and this is a few years ago. And that experience of seeing him through that journey really reinforced for me how critical it is to be able to find and use good information to inform and advocate for good healthcare choices for you and your family. I can say that I was able to access critical research that ended up really changing his treatment outcomes for the better. And that was a very powerful thing.
Yeah, definitely. And thank you for sharing your personal experience. In nursing, we call this term phenomenology, which is basically relating to something that is that you have experienced. It's a very powerful thing. So yeah, nowadays we live in a world where information is easily accessible to everyone with an internet connection. However, despite technology bringing people closer to each other, it can also overload us with information, things on Facebook, on Instagram. So how can we tell what source is credible and what is not?
That's a great question, Kelly. I think, the internet is an incredibly powerful tool, and it's powerful and empowering. And it can play a very important role in how we manage self-care and decisions about our health. But there are risks as well. The fact that the internet has made it so easy to make information available means there is a mix of reliable and not so reliable or even dangerous information out there. When it comes to your health and the health of your family, that's a big risk. So my message is take advantage of this incredible tool, the internet, but learn how to evaluate information for reliability, accuracy, and currency. So we need to ask ourselves some questions. Who has written this information and why should we trust them? What are their qualifications? Are they trying to sell us something? We need to look for authority in the information. Look for information about the author. Does the website tell you the author's name and credentials? Ask yourself, what is the evidence? when it comes to health, we need more than someone's word or opinion. So like we just talked about, look for evidence of authority or expertise. It's also very important to look for signs of bias and to ask yourself what the author has to gain by providing this information to you. Is the information politically motivated? Is the information being monetized in any way? A reliable information source should also give you a clear sense of the evidence behind the information. In other words, it should tell you which studies form the basis of the information provided, and ideally it should give you enough reference information that you can track down those studies yourself and verify that information. You can look for information about how current the information is. There are constant developments in health sciences, and it's important to seek out up-to-date information. If you can't find a publication date on an online health article, that would be a reason to question its reliability. I always recommend verifying information in at least one other source you feel you can trust. If you can't find any backup verification for the information you find online, then you probably shouldn't rely on it.
Thank you. And this is definitely helpful nowadays. When we're looking online, we see a lot of the information regarding COVID-19 vaccines and then the spreading of disease, how effective are masks. It's really important to check our sources, who's writing them, where are they coming from, just so we can have a unbiased opinion on certain topics.
Absolutely. I heard someone say on a radio interview, I think it was on CBC, that we're really, with COVID, we're really watching the scientific method in action in all of its complexities and imperfections. And we're seeing that process unfold. We're seeing how knowledge develops and builds over time. And I think that's a really important lesson for all of us.
Yeah, and keeping in mind it's a new virus, it's something that we still need to learn a lot more. And then scientists as well as us are, it's a progressing stage that we all need to develop together.
Yeah.
Yeah. So bring this to the community level. So as important as health literacy is, a lot of people in the community might be afraid to learn more about their health. So how can people in the community empower themselves and become more health literate?
I mean, there's many different ways, but first I'm going to put in a plug for your local librarians. So ask us. We're not scary. At least we oughtn't to be scary. We're friendly people. There are wonderful librarians at the public library. There are librarians at VIU Library, which community members are more than willing to engage with, to ask us questions, to ask for help finding information. You can phone, email, drop in. Well, these days that might be harder to your local public library branch for help finding the right information to solve your problem. Libraries are good sources for credible health information. We have up-to-date reference tools. We have online databases that give you access to very current, reliable, authoritative health information. Community members, again, are free to use the VIU Library search engine to find references to good academic health information. And there are a number of different ways to access those. You can come visit the library, and we are still open with precautions in place during the pandemic. Just ask us for help. I can also talk to you a little bit about more open access resources as well, if you like.
Yeah, and I just remember I recently visited the VIU library, and I can see that they've added a self-checkout, so it's minimal social distancing. There's screens between the librarian and you, so it's a relatively safe platform.
Yes. Oh, yeah. We're very carefully following all of the provincial rules and VIU's own guidelines about keeping our community safe.
Yeah, that's great to hear. So just another topic on self-empowerment and, learning more about health literacy. What are some credible resources that you recommend to people, whether it's, online or in person, that if they wish to learn more about their health?
Yeah, absolutely. So I think there's a range of resources, and it depends on really what the issue is that you're wanting to explore. So for me personally, when I have what I would say is a non-critical health concern or question. Let's say I notice a rash on my arm that's strange and it's a bit itchy and I don't know what it is. One of my favorite sites just to check on those kinds of things is mayoclinic.org. So the Mayo Clinic, of course, a very famous medical facility, and the website's wonderful. It's comprehensive. It's full of excellent, well-written, accessible articles about a massive range of very common health conditions. So if you're seeing something, it's just a little bit strange, you have some questions, I often go there and take a look at what Mayo Clinic has to say, and I find that a really good source for me for those personal questions. Now, when you want to dig a bit deeper, so of course, I'll go back to my, the example of my dad. So there are times in life when we have more complex, scarier issues that feel a bit more critical, right? Mm-hmm. And there are times when we want to go to that commensurately complex, detailed information sources that can help us work through it, or to check what our doctors are saying, to verify all of those good health literacy strategies. What I would suggest is, we already talked about the public library and using the VIU library search engine. I would like to point out too that when you go to the VIU library homepage, you'll see our search engine right up front, and you'll see tabs that let you scope your search to a variety of formats. There's an open access tab there. That is going to let you search through good quality, reliable information that's freely available. And that's an important point because, unfortunately, information is big business and health information is big business. Not all excellent health information is available for free. That's why I keep talking about libraries, because libraries are paying to access this information on your behalf. So if you take advantage of your local public and university library, you can tap into a wealth of resources that aren't available for free. However, many excellent resources are available for free, or what we call open access. And the open access tab on the VIU library search engine really helps you narrow your search to those resources that you know you're going to be able to access no matter what. One very good open access free medical search engine is called PubMed. That's a very good tool to use as well. Another great open access source is called the Cochrane Library, so cochranelibrary.org. And what the Cochrane Library offers is it offers open access to what we call systematic reviews. This is really important because what systematic reviews do is that they review research over a number of years and according to specific criteria. So these are studies themselves that consolidate, analyze, and synthesize research that other studies have gathered over time, finding patterns, finding consistencies, and establishing, probably the closest thing we can get to quote unquote truth in any of these matters, right? So systematic reviews are a very important tool, and there's an open access source for those in Cochrane Library. Also, Cochrane Library contains good information about clinical trials. And, when you are facing something like a very serious disease, that clinical trial information can be very, very useful information to be able to access and to educate yourself with. There's great open access sources. We try to make those very accessible through our library. The public library is a great help as well. Those are some good sources. And I would say too, don't limit yourself to the first couple of pages of Google results that you get. Again, there's a huge and valuable world of information out there that won't be delivered up for free with Google. Use Google or our library search engine or a number of tools to identify information that's relevant to your topic. If you run into barriers accessing, so if you're out there on the internet and you find a great source that looks like it's just going to be excellent for answering whatever health question you have, and you hit a paywall, I know we've all experienced that, get in touch with your public library, get in touch with us at VIU Library, because in most cases, there will be ways where we can help you download and access that information that is not free because we have paid for it on your behalf.
That is excellent to hear. And just to confirm for our listeners out there, the open access meaning that it's free for the general public, is that correct?
Yeah, absolutely. So open access, an important term in librarianship. And what that means is that research and information that is most cases paid for with public funds is accessible publicly in perpetuity. It's not hidden behind paywalls. It's not monetized by publishers. or information providing corporations. It's being made available as a public good, and in the vast majority of cases, it has been paid for with public funds.
All right, thank you. I actually learned something new today. I wasn't sure what open access meant. And just to finish off, do you have anything you wish to add?
You know, I probably, this is probably my own hobby horse that you're tapping into here, but I will say, I don't think I can finish talking about health literacy without mentioning Wikipedia. So I have to say, that I adore Wikipedia. I mean, I think as a social experiment and as a in general an information literacy tool, it is a very interesting phenomenon. Now, Wikipedia, as we all know, it's ubiquitous. You know, you search for everything. You search for, strange rash on my arm, there's probably going to be a Wikipedia article that comes up, right? Or certainly if you search for something like pancreatic cancer, there'll be Wikipedia articles. And often they are excellent because Wikipedia, it's open to everyone, and it's also open to everyone to write and edit. Now, that can be a double-edged sword, like we talked about. There are some of the best experts in the world contributing to Wikipedia health articles, and the information there is excellent. So in those cases, Wikipedia articles can be a great source. But the thing is that you don't really know if the greatest health experts in the world can contribute to Wikipedia articles, but so can everybody else. The interesting thing about Wikipedia is that it's absolutely transparent who is contributing and who is editing. So you can tell, you can follow that path of how that information has been constructed, which is really, you don't get that much in any other information source. So what I would say about Wikipedia is appreciate it, use it for what it is, but again, always verify. You will definitely run across Wikipedia articles many times, or even most of the time, they're going to be useful and helpful, but always verify with another trusted and reliable source, because Wikipedia is, of course, open to editing by many different people with many different agendas.
Yeah, and I really like the double-edged sword analogy. It's important to approach such a valuable source with caution in that sense. And it's great that it's free, but then at the same time, do we really know who's behind the screen doing all the editing? All right, so that concludes our interview. Once again, I just want to say thank you on behalf of all my classmates. Jean, just thank you very much for participating and working with us. And thank you for joining us at CHLY 101.7 FM.
You're welcome. Thanks for having me.
Next, we're going to play you part of a TED Talk by Dr. Lisa Fitzpatrick, a CDC-trained medical epidemiologist and board-certified infectious disease physician with both global and domestic experience in public health. Dr. Fitzpatrick breaks down the importance of health literacy in a very clear and understanding terms. Have a listen.
This is my dad. He's actually one of the smartest people I know. As you can see, he's a Cardinals fan. That's because we're from St. Louis, Missouri, which is where I grew up. I was there a few months ago. We were having breakfast. We were having a conversation. Dad, how's your health? I'm doing great. Next week, I'm going to see my gynecologist. Your urologist. Oh, yeah. Dad is not alone, though. He got a little mixed up. Raise your hand if you've ever been confused by a medical term or something your doctor said. In my 20 years of experience in public health and medical epidemiology and medicine, this confusion transcends race, gender, age, income, and geography. That means we have a problem with health literacy. Health literacy is the ability to understand and utilize health information. But what's interesting is we're bombarded by health information almost 24 hours a day. But people are still confused. They don't know what to eat, how much to drink, who to see for what. We have low health literacy. And low health literacy can get expensive. Latest cost estimates of health literacy, low health literacy, are up to $238 billion a year. That's because people who have low health literacy are more likely to enter our healthcare system when they're sicker. So they show up in the ER, they're hospitalized, they may even have surgery. These are our most expensive forms of healthcare. Now, I've been thinking about this for a long time. I've been trying to figure out, how do I use my interest and my skills to teach people about basic health information? So one day I was in a bike shop and I met a videographer named Francis Tatum, and I told him about my desire to educate people. So together we created Dr. Lisa on the Street. Take a look. Doctors often speak in a language that people don't understand. Has this ever happened to you?
Pretty much all the time.
Oh.
Sounds to me.
Not cooking food properly.
That's salmonella.
Well, that's no.
Okay.
And I don't want one. I see everyone pushing it, and they keep pushing it, and everyone keeps pushing it. I'm sick of corporate America pushing stuff on me.
Sean got some Pop-Tarts.
Yeah.
Okay, didn't you just tell me that we have to cut down our sugar?
I did.
And you're a diabetic, and you have Pop-Tarts and Fruit Loops.
These are the kidneys alone.
You said kidneys are lungs?
Kidney all alone.
So that's the kidney. This is the lung.
The hospital with her one day, and she wanted to say she was pregnant, but she said, "Oh, I got a stomach ache," and something like that. So it depends.
You go to the emergency room and get a physical. So do you have
sometimes,
yeah?
It all depends.
But how do you think we can get the message out to them?
The way you're talking to me now, each one teach one and spread the news.
All right. I'm Dr. Lisa. I'll see you on the street. So what have I learned from walking the streets? I learned a couple of important things. The first one is the grapevine is a powerful educator. Now, I suspect most of us are getting some of our information from the grapevine, whether it's through casual conversation or the media. It's like the game of telephone. You tell the first person, and then by the time it gets to the end of the line, the message is all garbled. But the grapevine's not all bad. It's actually pretty effective at transmitting information. The problem is a lot of the information just is not true. And when bad information gets on the grapevine, it creates chaos. A fantastic example of this is the recent Ebola scare. Remember that? There wasn't enough information reaching the public. So the grapevine took over, and what happened? We closed schools. We quarantined people in hospitals. We barred people from airplanes. We even kept a cruise ship from docking. That's because there wasn't enough good information on the grapevine to counteract all the misinformation. This is a great example of why we need better information on the grapevine. Now, the second thing I learned, and I knew this to an extent already because everybody I talked to on the street had a doctor. But I learned we are failing to educate you, our patients. And I think we're failing for a couple reasons. First, because our tools are outdated. Not just our physical tools, but the strategies we use to communicate with people. For example, this is a health literacy test. I ask a person to read the words on this paper, then I give them a score, and voila, I'm supposed to know if they're health literate. Now, this test might tell me if someone can read, but I'm pretty sure it doesn't tell me the things I really care about, like will she take her medications or will he keep his appointments? And look at this. I still have a fax machine in my office. Raise your hand if you've never used one of these. Right? At a time when patients are asking us to communicate with them via text and email, doctors are still communicating via fax, and even my dad has a cell phone. But we're also failing because we use language that's comfortable for us and not you. I asked one of my colleagues why he wasn't testing his patients for HIV. And he said, well, I've had most of these patients for 20 years. It's just awkward to bring it up. So I thought for a minute, and I said, do you prescribe Viagra? He got the message. He was denying his patients an opportunity to be as healthy as they could be. So why does all this matter? It matters because research shows that for every $1 spent on health literacy, we can save $25. That means if we spend $1 million on health literacy, we can save our system $25 million. That's impact. But it also matters because of people like John. He says things like, I don't trust doctors. They're nothing but drug dealers working for drug companies. But then he said something that really struck me. He said, doctors don't listen. If I go in for a headache, I don't want you talking to me about my liver. I just want something for my headache. I had to explain to him the headache is actually a symptom of a much bigger problem, and it's our job to figure out what's causing the headache. Well, John was diagnosed with diabetes 2 years ago, but before that, he hadn't seen a provider in 10 years. And at that time, the doctor told him he was pre-diabetic. But he didn't go back because he felt fine, but also because he didn't like the way the doctor spoke to him. Fast forward, he sees another doctor who says, guess what? You have diabetes. He puts him on medication, but John stops taking the medication without even talking to his doctor. And almost a year later, he's rushed to the emergency room in an ambulance in a diabetic coma, and he spends 8 days in the hospital. He is a great example of why health literacy matters, and our healthcare system is flooded with patients like John. So what can we do about it? First, we can manage the grapevine. The grapevine is like ivy. You know what happens to ivy. You've seen it. If you don't maintain it and control it, it spreads like wildfire. And bad information travels very fast on the grapevine because it's associated with drama. And people usually love drama. But we don't want to destroy the grapevine. We actually need it. We need it to help counteract the misinformation. So what can you do? Before spreading information on the grapevine, verify it. And don't believe things just because they sound true. Next, I think doctors need to embrace technology, but you have to push for it because the change in our healthcare system comes from demand from you. And nowadays, almost everybody has a device. I was riding my bike last week, and I turned down this small road, and there was a group of people standing on the street, and nobody waved. Nobody even saw me because they were all looking down at their cell phone. I believe if we are this captivated by devices, we should definitely use them to educate people with health information, don't you? So you push your healthcare providers toward technology. Thank you. Please. Take control of your health. Your health literacy is up to you. So avoid gaps in care. Remember John? It took him 10 years to get back to the doctor. But his illness was completely preventable. Find your healthcare provider. John was frustrated because he and his doctors were mismatched and they didn't meet his expectations. Unfortunately, there's no Match.com for doctors and patients. But that's a hint to you entrepreneurs out there. He became frustrated and discouraged, and he gave up. But he was the one who suffered in the end. So don't be like John. And finally, be persistent in getting the information you need. Ask if you don't understand something unapologetically. I know office visits are short, but that's our problem. It's not yours. So speak up and get the information you need to be healthy. I'm Dr. Lisa, and I'll see you on the street.
That was Dr. Lisa Fitzpatrick, a CDC-trained medical epidemiologist and board-certified infectious disease physician, speaking about the importance of health literacy at a TED Talk in 2016. We hope you enjoyed today's episode. We encourage you to reach out to your healthcare provider for more information. As always, check out our Facebook page for resources for today's show. If there are any topics you'd like to hear us discuss, let us know by email at asoundconstitution@gmail.com. Thank you for listening to A Sound Constitution on CHLY 101.7 FM.